Little with the emphasis on little. It is,
Okay. Okay.
yeah.
It's a cozy space.
We'll manage, I guess.
That's good.
Lynn, that article you sent was excellent. Wow.
Do you know, so that article was, I think Joe actually had reposted that or somehow after.
Which one?
The
Service bees,
Serviceberry, but which
Yes.
service berry.
Yes.
Nicole
Yes.
Allen had originally posted it. So Tom and I were having a conversation in which it was really relevant. And
Oh, man.
isn't it
Yeah,
great? The Serviceberry.
Yeah. I thought it was, it was an article that a lot of everybody needed to read or at least ponder. Just think about it.
Well, it's just that when you grow up in a particular set of conditions, you don't realize what other alternatives are available. And that's the first time I've heard sort of a great explanation of what economy is.
Mhm.
Economy of scarcity. And so,
Yeah. I have this book that
great.
I think I got this book from a friend about 6 years ago. And the name of the book is called Scarcity. And it really delves into that we live with that feeling of almost an artificial idea of things being scarce. So we create these barriers between everybody. I think I'll try to get it to you. I think you would enjoy it. Hi, Jane. You're muted.
Hello. Yep.
Hello. How are you?
I'm pretty good. And yourself?
Doing well, doing well.
Good.
Well, it's a year that we are going to figure out.
We will figure it out.
That's the spirit, you two. We're going to figure it out.
Oh yeah, I mean, that's the least we can do.
That's right.
Yeah.
It's a work in progress.
Yep.
I have all sorts of support in this room. So I'm at the Hutman room in the Brookins building because
Okay.
that's the meeting room that's posted. It's sort of a regular meeting room. It's next to the regular meeting room. This is in an effort to fully comply with the revised Open Meetings Act provisions as we are primarily doing remote participation. We don't want to lose access to the public. So I'm right next to an unlocked door where the
Just
public
in case.
can come in. Nope, this is where the public can come in if they want to participate. Jesse's with me, making sure that the county's computer can be signed into if someone does show up. We have a way, and there's an exit here, and there's a sheriff's deputy sitting outside.
Oh, okay.
Isn't that
You
nice?
are very safe.
And I got some advice from our attorneys, which also, in addition to those couple of things, included making sure I go out and check to see if anyone has come to give public input, and then locking the door after that. So when we get to the public participation section, I'll leave for a second just to go check on people and then lock the door.
Good. So how's it going, Elaine?
Oh, aside from breaking my index finger,
Oh,
I'm fine.
apart from,
It's typing interesting.
how did you break your index finger?
I was carrying my printer to be repaired and
Oh.
it was big and heavy and I somehow fell. I'm not sure how. And the printer fell on my
Oh,
fractured it. The printer doesn't need to be repaired now. It's,
Now your finger needs to be repaired. Oh,
But
well.
it fixed itself.
So you
We have a
dropped it
new
and it fixed
printer.
itself.
we have a new one now. So the
Oh, okay.
problem was solved.
Problem solved.
When I was in college, I worked in the steel mill. We had repair guys. When you call them to fix your machine, they always showed up with a sledgehammer.
Okay, that's one way of fixing it. So right now we just have 4 board members. Yeah.
The month has really flown. I kind of forgot we had a meeting tonight, and then I was like, oh, honey, I've got a meeting.
Yeah. There's Jillian. So that's
Hi, Julian.
Hey, Julian.
5.
That's 5. So John usually shows a little late from work,
Right.
so that's fine.
Right.
Kim Brody, there's 2 there.
I said hi, but my microphone was off so high.
It's like, gotta say it again. Yeah. So how's it going, Julian?
Well, let's see. It was a good day today.
Yes, it was.
Nice things happened in the world.
Yes, something to look forward to.
Yes.
Something to
Maybe
look
it's the
forward to.
end of an era and the beginning of a new one.
Yes.
Only hope.
So let's see, 1, 2, 3, 4, 5. So we don't have a quorum yet, do we?
So 5 was a quorum.
Okay, 5, okay.
Len, isn't 5 a quorum? I
think, Stephanie, is that all right?
You're muted, Steph.
you muted.
Is 5 a quorum?
Yes, it is a quorum.
Yeah.
So we can go ahead and call to order and get started. Stephanie, can you do the roll call, please?
Susan Fowler, Tom Moore,
Here.
Elaine Valencia,
Here?
Kyle Patterson, Julian Rappaport,
Here,
Jane Sprandel,
Here.
Kathleen Worth Couch, John Paul Joachim, Joe Omo Sage,
Here. Okay. So I mean, if you're not here on Zoom, so we know what the Zoom instructions are. Is there anybody for citizen participation or input? So just wait and see.
I think maybe I'll go outside and see if anybody's there and come right back.
Okay, sounds good. And anybody on Zoom, is anybody willing or wanting to participate or have an input?
But Nicole's here every month, isn't she?
Yes, she is.
Okay, so no one responded, and so now I'm gonna go lock the door.
Okay. You're going now to lock the door? That's
Yes.
okay.
So no one's here to give public comment, so.
No
I'll do
one's
that,
giving
and
public comment either, so.
you stop, and you don't have to wait for me anymore. I'm sorry.
Okay, we'll go ahead. So let's we can move to approve the agenda.
So moved.
Second,
Okay, so let's, so Stephanie,
Tom Moore,
Oh, yes.
Elaine Valencia,
yes.
Julian Rappaport,
Yes.
Jane Sprandel,
Yes.
Joe Omosage.
yes. So I have very little, few comments as we start this new year and this new era also in the leadership of a country. And we face a lot of different challenges, on the mental health board and just as a nation in general, with race and mental health coming at in the intersection. I hope we can find a way in this community to make a statement that says there is something that we can do to at least start mitigating those circumstances. And also, as we look at COVID and how it's impacted us in this community, we seem to be moving in the right direction in this community, but it's still with us. My mom got her vaccination this past Monday, and she's feeling fine with it. So I hope everybody gets vaccinated soon.
Not mine.
You got yours too?
Mhm.
Me too.
You too. Okay, good, good. So very soon we might all be able to meet in person because everybody's vaccinated. Eventually.
Well, we still have to get number 2.
Yes.
Yes. Yes. Diana, my wife, got vaccinated, and she gets number 2. I think February 1st. So
Okay.
she's one person in the family, 2 people in the family. Thank you. So, Lynn, do you have any comments to add?
Did you all already approve the agenda and I missed it?
Yep, we did.
Okay, we have a board member saying they can't get into the meeting. So are there people in a waiting room potentially
I do not know.
to get in? I can't see it.
Neither can I.
Okay. So
I just submitted people. It was scrolled down, so I didn't see the admission.
okay.
So I
Oh, okay.
apologize about
Okay,
that.
so thank you for doing that. So anyway.
Thank you.
Hopefully, so we've got John Paul Joachim has joined us.
Okay.
Sarah Logayan. Okay, so for people who are not board members or staff of the mental health board, it's great to sign in to the chat. That's very helpful to us, and put your agency affiliation, if any. So for my comments, I actually made notes so that I can keep it really brief. And my notes, well, I don't even know where I put them. That's the
helps.
value of taking notes. I'm happy to be here without any safety concerns. I did talk to both of our attorneys about just the safety of being here, alone with the doors unlocked. And so we figured out a few things, and I already told you what they were. I think this meeting, I'm happy to start the meeting with what might be the best news in a while. And it's really about how, because we couldn't do an in-person expo during 2020, and it might be difficult this year too, the group who've supported the expos for a long time got very creative, and they're gonna give a presentation of some of the things that they've done and what's coming next and how it's going. And so I'm happy to start the year with something upbeat. I think that we all deserve that. But then the next big part of this meeting is an update on the Scylla project, which is a little bit less happy. So I just need you all to know about the things that we've done in the last year and get up to date, and then kind of think with me about what could happen next. So I'm happy to see you all, and I'm glad that I'm safe here today. So anyway,
Thank you.
that's the main thing. We did as follow-up to the study session in December, in which there were many comments about access, and this whole thing of me sitting here is about trying to keep as much access as we can to the people, and the expo is all about creating access for people. We tried some of the things that were suggested at the study session. So if you look where the meetings are archived, you'll find a fully captioned English version of the meeting and a Spanish version of the meeting. And it was a little bit expensive to do, but it's very nice. And I'm glad that we have it, especially for a meeting that is about access. So that's one of the things we did. We also, as a staff, brainstormed and added some information to the agendas and the schedules about what else we might, that we would like to be more helpful if people need anything in order to support attending the meetings or providing you with input. So that's it. Thanks.
Thank you. Thank you. So we're going to move into new business, and we're talking about a Disabilities Expo. And if you're looking at your package, it's on pages 4 to 30. So is Barb there, or someone, or Dylan?
Well, we have 4 people today to talk to you about the expo. The longtime coordinator of the expo, which is Barb Bresner. She's done this for 13, 14 years, maybe infinity. And her assistant coordinator is Jim Mayer. And then we have a new assistant coordinator coming up in April, and that's Dylan Boot. He's also on the call. He's been working with the expo for many years, but will now will take the place of Jim, because Jim has other stuff he's got to start focusing on in April. And then Allison Boot, who's been our public relations specialist for quite a while, is also involved in these innovations, and she's going to talk about the social media and media outreach parts. So.
Okay, thank you.
I guess I can start with this if you'd like.
Yes, go ahead.
Thank you. First of all, thank you for having us this evening, allowing us to share what we're doing with the expo. COVID, of course, jumped in there and turned everything upside down for us back in March, 2 weeks short of having our expo in person. And so we had to get creative. We looked at a lot of different options to do that, and came up finally with what we have been engaged in now. We are doing a 4-part mini series, kind of mini expos, you can say. And what we did typically at the regular expo in person, we have about 100 exhibitors. That's a lot to try to do in one Zoom meeting. So what we're doing is we kind of broke that and quartered it by category. And so we have already held 2 of those, and tomorrow will be our 3rd of what we're calling Third Thursday Resource Roundups. So the first one occurred in October, and that was our healthcare and equipment providers. And then we had at that one, we had a presentation by Health Alliance. We were trying to kind of keep as much of the actual expo as we could. And so a good many of our exhibitors signed on with us. We have had for each of these anywhere between 15 and 18 exhibitors join us for the event. So that's been pretty good. We had 50 some participants at the October event, and it seemed to go pretty well, I think. The way we are structuring these mini events is that we're doing pre-recordings of kind of little 2-minute overviews from each of our exhibitors. And then we also pre-record the presentation. Also a part of this is 2 15-minute breakout sessions that are live with exhibitors and participants. So each participant, when they register, can choose the exhibitors that they'd like to visit with one-on-one. That has gone pretty well as well. Also, we did our second one on November 19th, and that was our self-help groups, vocational, residential, and recreation organizations. And at that one, we had a presentation by the Epilepsy Foundation on seizure first disorder, or seizure first aid. Sorry, got tongue-tied there. Tomorrow's event is January 21st, is on advocacy, legal, and service organizations. We currently have there's over 70 signed up for that one. And our staff and our exhibitors and all those. So quite a few people will be involved in that one. Excuse me. And we'll have a presentation by CCAMR at that particular event. So we're excited to have that happening tomorrow. We have attempted to offer the same accommodations or some accommodations for folks that might need those accessibility wise. We have American Sign Language interpreters that are on the screen with us for all of the pre-recorded material. And then we also have, for those requesting it for their breakout rooms, we have an ASL interpreter available there. We also are doing, everything is, we have Spanish subtitles and closed captions on all of that pre-recorded material. Let's see what else. You know, we've, many of our sponsors that we had have stayed with us for this. So we've had some nice radio and television promotion. We've had our gift cards we're able to give out as kind of a little incentive to folks completing a survey afterwards. And that's been really, really helpful. You know, we've done some of the basic promotion that we do, but a lot of that has come through social media, you know, with everything being virtual. For this event, that seems to be a really good way to get the word out and has been. So anyway, I'm going to turn it over to Jim, I think now, and he can tell you a little bit more about how things have gone with events.
Thank you.
All right. Hi, everybody. So what I thought would be a helpful way to explain how this event series has been working is to show you our website. And so I'm going to try to do a screen share, and I apologize if you've already spent time recently on our website, and I'm, you know, but I'll just hope you'll bear with me on that. If you don't mind, I thought it would be a nice kind of visual aid to use tonight. So let's go with that. All right. So here's our homepage for the Disability Resource Expo. And as you can see, we kind of reworded it a little bit different to refer to the 2020-21 events, since it's more than just the one live event. It's this series of expo events. And so I'm going to click on the events page. And here you'll see information about our Third Thursday resource roundups, among other things that we've been doing this year. And so you can see this kind of kicks off in the first paragraph. That paragraph actually had the link for people to register for our event that's tomorrow, but that registration closed, you know, on Sunday, this past Sunday, so that we could get everybody organized into their breakouts and so forth. So that's why it says, you know, thanks to those who registered, and explains that soon we'll be posting our registration for the fourth and final event, which is on February 18th. That one will be featuring education services and services for young children. So after the little kind of registration paragraph, then, we go on to kind of just explain how this series came about, that it was, an effort for us to still get information out during this year of COVID-19. And what it, in addition to telling, what all the various topics were for the year, it has here, as you can see, if you can see where I'm circling my cursor, we have posted videos already from the first two events. And so from our October 15th event on healthcare and equipment, we have the, first of all, the link to our exhibitor overview. Barb mentioned those little 2-minute interview clips. We basically put all those interviews together in an exhibitor overview that's shown at the beginning of each event. It's about a half an hour overview video that shows, in this case, all 15 exhibitors we had on October 15th, and gives, a nice overview of them and what they provide and how to contact them. And then also there's a link here. The second link is to our presentation on Medicare that was given by Health Alliance. So that was our featured presentation that month. Then you go down to the next paragraph and you see videos from our November 19th event. You'll see the exhibitor overview, similarly, first, of our support groups and vocational residential recreation providers. And then you'll see that there's a link to our featured presentation, which was, as Barb mentioned, it's on seizure first aid, that was given by one of our exhibitors. Basically, one of our exhibitors each month is giving a feature presentation because they had actually been slated to present live at our event that had to be canceled back in March. So we managed to honor those commitments to those four featured presenters, and it fits nicely into this monthly format. Actually, when those presentations are happening, that gives Kim Bowdry a chance to reassign people to their second breakout room. So it's a kind of a nice little time buffer, the way that it works out. Our event goes overview, then breakout number 1, then featured presentation, and then breakout number 2. And so it's kind of a nice mix, I guess, of watching pre-recorded videos and then doing live discussion with an exhibitor of your choice. And people register by letting us know their top 4 choices for exhibitors, and we tell them we can honor 2 of their top 4 choices. So everybody gets some choice in the matter of who they get to visit with. And, and it's we've kind of framed it as you're going to be in this small breakout room. It's kind of like visiting someone at their booth in a small group of, usually have anywhere from 3 to 6 participants in a given breakout room with an exhibitor to visit. So it kind of gives you, that overview, which is kind of like a quick walk through that part of the exhibit hall, that virtual booth exhibit hall, and then people get to have that individual visit. So continuing on, this explains that this year we did go ahead and print our resource book as usual, and that is available. We've dropped them off to a number of agencies. I should say mostly Barb has dropped those off, and we have still some available. If you know of any agency that would like a stack of our resource books, we have still some to distribute. And then also people can click right here on this link and get a PDF of our resource book, and it has all of our our ads are in there for our sponsors, so that's been honored. And we also feature our sponsors in our exhibitor overviews each month, so they're still getting some nice airtime. And then finally, this item number 3 explains that our website has added video clips. So besides the video clips you see here, I'm going to show you where we've embedded video clips in our exhibitor description pages. But just to finish out this events page, there's a captioned informational video that Lynn's daughter Xanthi produced for us last year at this time. It's a really nice overview if you haven't seen it about the expo. And then this explains also, for our return to a live expo, which we have tentatively planned for October 16th of this year. There's an example of the map that we had drawn out for the exhibit hall for this past one that had to be canceled, as well as the map key. So a potential exhibitor can look and see, what the event might look like if they're looking to participate, and also, for a potential participant who's never been can kind of see, oh, this is how they lay out things at the Vineyard Church for the live expo. So that kind of gives that page. Now I'm going to travel to our resource guide. And for those of you who haven't perused this yet, you can see people can access it by category, or they can just alphabetically go down the list. And this features some of our key exhibitors from the past, plus all of our present exhibitors. So we wanted this to be sort of a cumulative, comprehensive guide for our community. And what it now contains, in addition to the basic description and contact information for these organizations, is we have videos to post. And So from our 2 events so far, we've had approximately 30 exhibitors. And so those 30 exhibitors, you'll find their 2-minute little interview clip will be on their part of their description. People can view that 2-minute video. And also, we've, as Lynn has probably mentioned, we've had U of I students volunteer to produce some promotional videos for us this year as kind of a secondary project beyond these resource roundups. And so we've had about 15 now of those produced. And so I'm going to just show you 2 quick examples going down this list. I'm going to go first to Behavioral Perspective. They are one of our exhibitors actually for next month. And they are our featured presenter actually next month, but they also did a student video. And so when I click on their resource page, you'll see their description, their contact info, but here's a link to their student video. And then after their event in February, after they participate in our resource roundup, they will have a second video on here, which is their video clip from the resource roundup. So now I'm just going to show you one other example of, I'm going to go to C-Carts, which is, the rural service that MTD coordinates. And C-Carts was an exhibitor back in November with us. And so if we go to the C-Carts page, you will see, just as I mentioned, that once a person has participated in our resource roundup, this is the 2-minute clip from our brief little visit with the folks from, and I'll just click on that so you can just see. I won't play the video, but I'll just show you what that brings up for you. Is it's as you can see, it's a minute and 44-second video that shows Barb and myself interviewing Drew Bargeman and his colleague at MTD, and then you can see our ASL interpreter is there with us as well. And then this is, as you can see, there's closed captioning. You can see Barb saying hello there. So so these videos, have all of those nice accessibility features embedded in them. All right, so I will go ahead and quit the screen share here and come back to your regular meeting. All right. So any quick questions on the website before we move on to Dylan and Allison? Okay, I will mute then and turn it over.
Thank you.
Hi, my name is and Allison. So before I get started, I want to share that if at any point you guys have a hard time understanding me, please just let me know and I will repeat myself, or I will ask Allison to repeat for me. So I am in charge of the service that we ask our participants to fill out. And I want to just touch on a few highlights for you guys. So the first statistic I would highlight is that we asked how effective our approach for this kind of event was. And as you can see, 90% of the responses rated at a 4 or 5 out of 5. So this tells us that we are being effective at what we're trying to do. Next, and we asked, how accessible each of the sections of our event were. And so for all the sections, it was at least 80% at 5 on 5. So, this tells us that for the most part, our events are very accessible. Next, and these are just a few of the responses to what they like the most. And I'll let you guys read it for yourselves. But you can see that everybody was quite happy with what we provided. So I'm going to turn it over to Alice next, and she is going to talk about more of the social media aspects of what we're doing.
So, as Lynn mentioned earlier, I've been handling the Expo's PR for quite some time, and a big part of that is social media. We have platforms on Facebook, Twitter, Instagram, and most recently YouTube. Facebook is our most established and largest platform, so the data I'm about to show you is specific to Facebook. Unfortunately, due to the limitations of their current algorithm, we only have the last 4 weeks. But going forward, I've started a spreadsheet so I can collect more data. So this just shows that over the last 4 weeks, we've had 63 people that searched for the Expo page on Facebook itself and viewed it. And over 2,000 people have seen one of our posts come up in their news feed. I post multiple times a day, 5 or 6. I tend to not only post about our Expo events, but also local and national disability related news. During that same period, we had 358 post engagements, which just refers to people who liked, commented, or shared one of our postings. And then we had 400 people watch at least 3 seconds of one of our videos. And that does not include people who viewed them repeatedly. We did not have an event to promote in December, so that's why there are some pretty large spikes in engagement regarding some of these categories, but that should give you a pretty nice overview. Does anybody have any questions regarding the survey responses or social media?
I have a question comment. I really appreciate all of the enhancements to the website and the addition of video, which is something that people had asked us about over the last couple of years. One of the things that could happen with the video is pushing that out on social media, but I don't know if you've been able to do that yet and if it's been very helpful or what This is really for Allison. Like, has that worked very well?
I can speak to that. I have been able to post videos on some platforms and they have gone over well. Other platforms I've not been able to post on due to video formats and incompatibility with that platform, specifically Instagram. But now that we are aware of those issues, we plan to address them in the future. So I hope to be able to post more videos on our various platforms because they do go over very well and receive a lot of engagement.
And the videos are, a lot of care has gone into, like the short videos are, they're designed to share an overview that might be helpful to a person who's trying to find the place. And I think this is one of the nicer collaborations that we've had with the university. And then the way that you've all been able to integrate video, and then Kim, taking care of the captioning and managing these meetings, which they sound so complicated, the TTRRs, but the product looks great. So I hope that we can continue to push the final products out because that information is gold.
I think this is just wonderful, and the amount of work you've done. I'm just thinking going forward, when we go back to in-person expos, I hope this kind of thing will be preserved and be part of it so that, people who can't get to the expo will have all of these resources, because they're just wonderful what you've done. So thank you.
I think that's probably one of the biggest benefits of having a pandemic is that we realize that technology can be part of the continuum of services that we will have at our disposal.
Yeah.
I just want to put in there also for the February 18th event, folks can pre-register for that. We do need to have pre-registrations, and those will the registration form, as Jim mentioned, will probably go up like the day after the event tomorrow. So, join us, and also if you can share the information through your social media or whatever, we appreciate that. Just help us to get the word out.
Yeah, and please encourage people to use our website as well. As you could see tonight, just doing the math, there's going to be probably somewhere in the neighborhood of 80 or so of our exhibitors at the end of this year between these Thursday events and the student videos. At least I think 80 of our exhibitors will have those little video clips, describing their organization. It kind of puts a face with the name of that organization. It's a pretty user-friendly little 2-minute clip, to give people that flavor of the organization and maybe even alleviate any anxiety they might have about going there for services. Some of them, they have actually even featured, what their entrance looks like and what their physical setting looks like. And part of our thinking was that could help a person who's maybe a little, anxious about going there for services, their first appointment. So that's just, an added sort of plus to some of this effort, I think.
Another thing that the website has helped with is folks researching, searching for places to get the word out about their particular services. We've gotten 2 new exhibitors that will be with us for February at the February event, as a result of the information on our website.
I just want to say, I'm really impressed by how, well this has all come together. And I know you guys have done an enormous amount of work to get to this point. And I just applaud your efforts and what you've accomplished. And I was just wondering, do you feel like you're reaching the amount of people that you've set for yourself? Is there any way that we can improve this? I mean, obviously you've done an amazing job. And where do you see the most people getting the information about the expo events? Is it from like social media or the radio, or where do you guys what do you guys hear?
I don't think we ever reach enough people because there are so many folks out there that need these resources and don't know about them. So, you know, that's an ongoing, and, you know, any way that we can do it to reach, you know, the furthest and get the most people aware of this. I think this, you know, actually the social media with a virtual event, social media is so important. You know, we have a billboard, we have, you know, signs on the buses. We don't really know where people are learning about it from. You know, we also do a lot of email blasts, and that's another place where board members can become involved. Is, you know, we do a couple of email blasts leading up to the event, and you guys have lots of contacts, I know. So, you know, sharing that is a major help.
And John Paul, to further answer your question, I would say, you know, we wanted to offer this year during COVID so people would have some source of information, and I'm really glad we did it. But the other thing we've had to realize is, you know, I work with school-aged individuals and their parents, and, you know, a lot of our families this year, I think, are just struggling just to help their kids keep up with school. And to add one more Zoom event for them was, you know, just a difficult ask. And so, you know, we've had, you know, some parents who are really glad to get the information and glad we're offering it. But, you know, we realize that our numbers are affected just by the reason that we are having these virtual events, which is COVID-19. So anyway, that's, you know, and that's not to say we still want to, as Barb said, get the word out as much as we possibly can and reach as many as we can. But that's part of our hope too, is by having these videos and having this stuff on the website, that even if people couldn't do the event, you know, they can come and see those videos after the fact, and they've got captions and ASL and all those good things. So, you know, that's part of our plan too, I guess.
Thank you.
Any other questions? Thank you.
You're welcome. Thank you very much for doing it, and thank you for all the years you've put into it.
My pleasure.
Thank you. So, an update on Scylla.
Okay, so here's the bad news.
Okay.
I'm trying.
Okay, bring it.
It's really not all bad news. Like this project has done some of what it intended to do, and it's just we are running into the same obstacles that generated this in the first place. But I wanted mainly to bring you up to date on what we've done from the technical perspective, including if we need to find a new provider for Scylla services, if that's the direction that the duty board and the mental health board would both like to go in the future. We have the RFP is ready. If there's a draft of it, that might not be the direction that the boards want. But just so you could see, just for the sake of example, you could see that the timeline is a little bit involved. If we were to start an RFP process in March, it would not be completed until early September, because you want to make sure that there's an opportunity for public comment. So if this is not the right thing to do, it's okay. I just wanted to be prepared if it does become the right thing to do. So if you don't mind, I'd like to share the screen if that's all right with y'all. You all have the board packet, but just to make sure that anyone watching this meeting knows what we're talking about in the future, there's a memo that is a really kind of brief overview of the efforts since 2014 to respond to the needs of people who whose families were here, who grew up in this community, but who, when they became adults, were not able to find residential placements close to home. So either they were staying at home, or they were in institutional care, or they were placed 3 or 4 hours away. So those are not good situations. And to be fair, families who have adult children with disabilities are dealing with barriers like this all the time. So it's not news to anybody. But there was a cohort of people who were just sort of like, maybe they were too hard, or they had behavioral support needs that were difficult to meet. So they had just not been able to live close to home for a while, and that's dangerous, and it's hard on families. So our effort at the time was sort of within the context of federal incentives that are called Money Follows the Person, and that program has been renewed for another 3 or 4 years. So if the state of Illinois chose to take advantage of it, what it does is provide financial incentives for bringing people who are in institutional care and don't need that level of care into more community integrated settings, such as small group homes. So there just weren't a lot of small group homes available. It has been difficult in Illinois. Hi. We're feeling very well supported tonight. Thank you. Well, that was nice. There's so many nice people here today checking in on me. Okay, so back to work. This project, we also have to be careful not to use these funds to supplement state rates. One of the problems with expanding the small group home capacity across the state is that there's not a lot of, the state rates are very low. So it requires other investments. Sometimes that's private donations, but that gets agencies into trouble because it's supplementing Medicaid, which is illegal. So the idea was, if we owned the homes and we were able to pay for the maintenance of the homes and offer them at a low or reasonable rent, that it might be easier for a provider to serve these people in this community. It worked for a while. So we've had a couple homes that were serving people who couldn't get services close to home for years, and they were okay for a while. And then the same things started to happen again. It's very difficult to maintain staff here. It's true all over the country, and we talk about the workforce crisis in Illinois, but it is true everywhere. And apparently it's especially hard in Champaign County to find and keep good direct support staff and qualified ID professionals who are like the supervisor for the home, and they're responsive to emergencies and things. So those problems started to occur again. And you might remember, we lowered the rent last year to try to create what financial relief we could offer. And we can't fix the big picture, but we could do these things. And then you all bought the homes outright a couple years ago, and we have updated all the agreements related to how much money is still owed to the project by the DD board. And then later we changed the title to the DD board because it seems more clear that they can own properties for this purpose, but it doesn't change any of the financial or program authority that you all have. So we updated all the agreements to make sure that, so for example, the leases were updated, the property management agreements were updated. We found some problems within those, some outdated language and some language which was not consistent with county ordinances. So it was good to go in just to change the technical owner of the homes and finding all these other things that were worth updating. We also updated the insurance and have some clarity about what the policy is covering. So deductibles 1,000, if you wanted to know. So all of that was important. You all did a resolution in October. Joe Omosage and Kyle Patterson met with me a few days later to transfer the titles, and we were in the recorder's office. It all went very smoothly, and then we revised the intergovernmental agreement between the two boards, and Joe and the president of the DD board met with me to complete that. So that document is in here, so you can see the complete agreement between the boards now. And I also thought it would be interesting to see, like, now that we've paid off the homes, what is the actual cost of doing this? And without mortgage expenses, with just kind of the repairs of the last 2 years, before adjusting for the rental revenues, total expenses look to be like somewhere between 20 and 30,000. And these are like inflated just a little bit because there is a trust. It's not really a trust. It was a gift to the mental health board, which can only be used for an individual who lives in the Scylla when his parents see a need for something. So they withdraw money from that. But it's recorded in your budget. So it looks like you have more expenses and more revenue there, but it's really for this related fund. So anyway, their balance is going down. The end of the story is one of the group homes is vacant. The residents have been moved to another community where it was easier to find staff. So and it's a different provider too. This provider had a really bad year when COVID came. They lost some staff who had to go home and take care of family members. They could no longer work outside of the home. And then in July, one of the key staff people was murdered. And that was very difficult for the rest of the staff and for the families. So one of the group homes is not occupied at the moment. The other one is full and people are doing well. And there's a report here from where's that? I think it's after this, yes. From the provider agency. They sent us a report and look, they're being so upbeat. I love it. They sent pictures of people doing interesting, fun things. So they're being positive. I should be too. But I'm a little worried because the project is doing half of what we hoped now. And we even had started with a greater ambition that we could own 4 homes. But the homes turned out to be very expensive to bring things into compliance with the state codes. So right now, waiting to hear from the provider, and it could take them a while, like if they believe that they can use the other house again, I think that would be great. But it's also their top priority, and my priority too, is the service to these people, which is it's true to the original spirit of all this, which was to serve some people who are difficult and had to be separated by long distance from their families or had no other options. So they're important. They don't have a lot of great local options, if there are any. But if they leave, if it's better for them to be served somewhere else by a different agency, then as long as they're safe, that's really important. And I think also that the safety and the well-being of the staff who are serving them is important to me too. So I'm not pushing this, but if we wanted to find a new provider, if they leave and can't do this anymore, this is a potential RFP to do that. There are a few details that would need to be adjusted. I'm open to other suggestions. So that's one option. Another option would be to sell the 2 houses and then you split the money with the DD board and that's all covered in the intergovernmental agreement. So that's something else to think about, or to repurpose the homes, to think of something different to do with the houses and then create an RFP for that. So in my opinion, those are the 3 options. None of them are right in front of us. But this is such a complex project and the RFP is very long. So I thought it would be nice for you to have all of this information before. That's the deal.
Are there any questions? Lynn and I have talked about this for several months.
Yeah. Well, I'm just wondering if the issue is workforce, then I don't understand how getting a different provider would change that. That's one thing. The other thing is the amount that the staff is paid. is determined by the provider or by
the state.
by the state.
And the providers have some discretion. This provider has a very low indirect or administrative cost rate because they pay this direct staff a little bit better. But
Mhm.
there really is the state rates lock these organizations, all of them, into a range of pay that is obviously not adequate to keep people, at least not in this county.
Yeah, so that's the main, really, the main issue. So we can't subsidize, I mean, there's just no way of adding money to, except that the minimum wage is going up, right?
Mhm.
So
Right.
that might make a difference.
You're right.
Yeah. My only other question, and this doesn't solve the workforce problem at all, but you mentioned repurposing, and these have been group homes for IDDD people, but have we ever, as a mental health board, talked about housing for people with mental health issues? Ever?
No.
I've just wondered, because I know whatever the mental health center used to be called had some of those homes back in the day, and I haven't checked on that for a long time. So I've always kind of wondered about that. I know that solves nothing financially, but just in terms of our mission, something to think about maybe.
I appreciate that. I don't have any well-articulated third ideas, but that's sort of the realm that I was thinking of. One of the homes is, we spent quite a bit of money making it very accessible. It's in a beautiful neighborhood. It's a brightly lit, fully accessible home. So it might be appropriate for older people or people with physical disabilities, or even for people with mental health concerns. So I have only worked on the original project's intent, but with the sense that people might have other ideas and suggestions that we should pursue. And it's not quite time yet, but that the time could come this year.
Okay.
But I agree with you, this workforce shortage is really big, and maybe the minimum wage will start right-sizing that, but it's a little big for us and for the DD board to solve.
Mhm. Yeah.
A random question is the salary determined by the state because the individuals being served have state insurance? So what if there was some that didn't have state insurance? Would that change how much we could pay those employees?
You sound like you might be familiar with how insurance works. But you have to make your money up from other types of pay sources.
I have just a little experience in that.
I agree with the solution. There's also, like, within DD, like, there's some these are persistent problems. They're not news. I've got them pretty well memorized. And there's, also the issue of DD rates is, Illinois is conspicuously behind. We are, for 3 years, a federal judge has declared us out of compliance with a consent decree which was on behalf of these people. And it's because of the state rates. They keep naming the state's Medicaid waiver rates as the problem. And we have some of the lowest states in the country. And we are always within the bottom 3 or 4 states in regard to the amount of investment. Illinois, a rich state, is like 47th usually.
Sometimes Illinois. I think Daria had a suggestion about in the chat about LGBTQ youth, and that was something I was also thinking about. And we'll go back to that, the rates also, and it wouldn't be able to cover that because we don't have a homeless or runaway shelter for young people any longer, do we?
So there could really be fine purposes like this. All of the money that has gone into this project was identified per your intergovernmental agreement as DD dollars. But that doesn't mean it would need to continue to be that. We could reallocate, you know. There are ways to settle that. So there may be other potentials outside of the purpose of DD service.
Which means that DD people don't get served all over again. We
I mean,
move it somewhere else.
And that's why I've been sticking it out with this, even when it looks bleak.
Yeah.
Because I think the purpose was really well intentioned.
Yeah.
I think it would be a shame with all the work that was put into this to just let it go. So, I mean, I think it's, you know, bestowed upon us to, as a board, to try to find a way to make this work somehow for the population that we're serving, because it provides a vital service to those families, you know, and I think, again, there's so much investment in those homes that have been made to make them compliant. It would be a big shame to just let that go. I don't know, that's just my thoughts. I think hopefully we can find some way to make this work, or be, you know, a little creative about it.
I heard my name. I was just going to say that Uniting Pride, we have been getting a lot of requests for housing resources and things like that. And most of them do come from adults who are homeless who do have IDD. So there is that crossover. Just tossing that out there. Sorry to interrupt.
No, that was thanks for bringing it up.
So when you're working with people who have intellectual disabilities, there is a correct contact for linking people to services. I'm sorry, Julian. I'll just send her a message. I'm sorry.
Okay, go ahead, Julian.
I ask you a question.
Yeah.
Has the DD board made any suggestions about this at all?
I presented this information to them this morning and we were really running out of time in the meeting. So individual board members have been texting me today about these issues and you know, just what we're doing is kind of going over the history of the problems around the costs of DD services rather than, it's just such a big problem that it's really hard to come up with like creative solutions all by ourselves, but we're just kind of getting, you know, we're getting reacquainted with the unfortunate causes of this. And I can share with you that what's happening is it looks like for providers, it's much more affordable to purchase homes in the rural areas nearby. And it's also easier to find people who are willing to work for $10 or $11 an hour because they can walk to work and then go back home. And, you know, so there's this drift of all these services out into the rural areas.
Mm-hmm.
It sounds fine. If you're like looking at it from a purely financial perspective, sure, the housing is too expensive here. Jobs, you know, have to pay better here because our rent burden is much higher. Unfortunately, the state rates are not configured that way. Like there's no difference between our rates and Douglas County or Ford County, no difference. So I would just like to share an example of a state that followed that trajectory for a little too long, and that was Minnesota. So that all of their nice little small group homes were out in the country, 3-4 hours away from family members. So that creates all kinds of unsafe situations for individuals, including many of them were disappearing. And so Minnesota is, I believe this class action suit may still be going on because it's horrifying that people just disappeared in the wilderness because the only place we could afford to offer them community-based housing were rural communities. So that's not the situation in Illinois, but I think when we are too comfortable with that as that's all we've got right now, I think we should pause and say, no, people need to live close to their families. But anyway, I'm sorry. But that's sort of where we've been today. between myself and some individual DD board members, like just kind of working through where this could head if we can't hang on to it or figure out a way. There may be some incentives through that federal program, the Money Follows the Person, that did provide financial incentives through the state of Illinois to providers back in the day. And that could happen again. So fingers crossed that.
Yeah, because I mean, there was a time when DSC and there were several group homes around Champaign in St. Joe and Tolono, but DSC got rid of some of their group homes on Green Street and Springfield, I think, because of that also.
Is there any push in the legislature to increase reimbursement or salary for these people? Now that we have a new legislature?
I have a dream.
Yeah, there are always rates committees that come up with the same recommendations every couple of years, and it's there's a big push. I think there really is sort of a strong political resistance here, and it has to do with other Illinois communities have some economic interest in the large institutions. The large institutions don't get any federal match, so they kind of suck up all the DD dollars for the state and limit what's possible in those communities that don't have large institutions.
It's like the prisons.
Yep.
Get a prison in your town.
And it may be some of the same communities.
Yeah.
Yeah. So I think that when we talk about legislative advocacy, it's possible there's a gigantic monster on the other side of that.
Yeah.
This is not rocket science. This is about paying people to do the work. So.
Yeah, no, that's not an American value, but that's a different story. I'm sorry. Are there any other comments or questions about the SILA? Okay.
Thank you for indulging me.
No, we need to know. So the contract amendment report on page 80. So any questions about this or comments?
No.
Okay, I do not see any hands or any comments. Okay, then it stands. So agency information. There are several agencies represented. Anyone have anything to add to the conversation or to speak about what you're doing?
Hey guys, this is Sarah from Macy.
Hey, Sarah.
I just wanted to comment real quick and follow up on my last request to you guys. I think that was 2 months ago in November about some supports for employees and self-care. And I got a wonderful amount of information and connections. We've started some new partnerships, did some staff retreats, working on some self-care with kids and looking into our employee assistance programs. So thanks for all the connections.
Thank you. Thank you for letting us know.
Nicole Secor at DSC.
Hi, Nicole.
Hi. I just want to tell you guys that we've received several grants for activity bags. So we've been dropping off developmentally appropriate activities for the families, and they've really been enjoying it. So that's been going really well for us.
Oh, thank you. Thank you. That's good.
Okay.
Any other good news? Bad news works also, but good news is a good thing. Tom.
Yeah, I just want to let you know, some of you probably already do, that I have submitted my letter, a letter of resignation for the board, and next month will be my last month of meeting with the Champaign County Mental Health Board. I think that I have been on this board maybe 14 years, 15 years, 16 years. I was younger. My hair was a different color and I worked.
Say it ain't so, Tom. Say it ain't so.
It's been a great ride, and I should tell you that the board has come together very well, and you guys have a great director, and the work that's been done by this board in this community is really outstanding. So I'm very pleased with what's happening. But I took a look at, we are going to have to go through another round of awarding proposals, and I couldn't make myself go through that one more time. So,
oh, Tom.
We hear you.
So ominous.
No, next month will be my last.
Tom, you were appointed January of 2005.
Holy cow, that's way too long.
Aw. Well, you will be missed. My goodness.
Yes, you will.
You're one of the pillars.
And no, you do not get a new car for your 16th anniversary.
I didn't know that.
You get a car. Oprah is not around, that's why.
Well, I have a daughter in like 5 weeks will be 16, and she keeps reminding her dad, you better buy a truck so I can start driving your Jeep.
Yeah. So thanks, Tom, for being a part of this and being a part of a lot of things in the community over the years. So, I mean, I don't know, if you know how to retire well, Tom, so I'm sure you'll be back somewhere.
No.
The answer is a big no.
No.
Okay.
Well, thank you very much, Joe.
As the kids would say, be that way then.
Yeah.
So, any other, apart from Tom's sad news, any other agency information, doings, questions, comments?
Hi, this is Hannah from United
Hey,
Pride. So I just wanted to add real quick. So beyond our youth and families programming that CCMHB funds and our support groups through that, we've recently added quite a few adult programs. One that is for adults who are transgender, and then one that is for partners of folks who identify as LGBTQ. And so supporting relationships and supporting those relationships and working with folks outside of our normal youth and families programming. And those have been really popular. They're meeting through Zoom. And it seems to be a way that people have been able to get some of the support that they need. So just wanted to update everybody on that.
Thanks, Hannah. Okay, if there are no other agency information, let's go to old business. And then schedules and allocations timeline. On our meeting schedules, I don't think there were any changes.
No change in the meetings, but there are some changes in the format. I want to make sure that the link to these Zoom meetings is easier to find, because if we're seriously trying to give the public access to these meetings, so we put a little bit more information on the schedule and also on the agendas
Mhm.
about, you know, how to find us, how you could participate. We don't have any Spanish speaking staff, but we have a Xerox machine that apparently speaks Spanish and can make copies of documents in Spanish, but I have not tested it and would not be capable of testing the accuracy of those translations, and they cost. So right now we just want to leave this at the request, like, you know, upon request, and then maybe we get fancier from there, just all in the spirit of like actually trying to reach people. So these were just the free thing that we could do was reformat the schedule. And all of the meetings for the next few months are in this room, the Putman room. So we're not in the Lau Shields room anymore, but there is not really an expectation that you could meet in person for quite a while anyway. And there's a chance that I would leave the Putman room and reschedule us just to be down in our office, because it turns out to be pretty secure, pretty safe too. So anyway, it's just the room sometimes gets moved around, the schedule's the same.
Okay, thank you. So the CCD.
So they had a very similar agenda this morning. This is probably the most identical that your meetings will get for a while. You have separate projects coming up, but you are on the same cycle as the DD board for the requirement of agency reports and the application deadline. So we are right now in an open application time, which means that we can't talk too much with anyone who might be applying for funding about what they should apply for, but we can help them if they have problems in the online system. The online system is also available to board members. So any board member who wants to log into that to read applications or look at any reports that have been submitted, you're very welcome to. And it might be easier to do with the person who developed the website, who's always happy to help. So if you want to do that, or you want to have the walkthrough with him, it's really easy to connect you to that person. And that's it. They don't have a study session next week like you all do. They do have a meeting in February the same day you do. And that at that point, we'll have hopefully hot off the press, a list of agency applications for funding to share with you. Because the deadline is the 12th, so it's real close.
Okay, sounds good. So approval of board minutes. So.
Move.
Second.
Okay. Any discussion? If not, Stephanie, please roll call.
Elaine Palencia,
Yes.
Julian Rappaport,
You're muted.
Julian, you're muted.
Oh, no.
Julian, no, Julian.
You're muted.
Julian.
Sorry, I did say yes, but you didn't hear me.
Jane Sprandel,
Yes.
John Paul Yoakim,
Yes.
Tom Moore,
Yes.
Joe Omosagie.
Yes. Okay. Board to board reports. So it's kind of really hard to do the board to board reports where we're not visiting.
Yeah.
So has anybody done any board to board anything?
I went to a meeting of the Rosecrans Community Board.
Oh, yes, yes, okay.
As a mental health board observer.
Mm-hmm.
And the main interesting thing in the discussion was something that's mentioned in these documents, which I forget where it is. Maybe it's in the staff reports, that Carl.
It's in two of them.
Carl is withdrawing from the One Door project and the Rosecrans it's unclear to me what Rosecrans is doing. But from that meeting, I think it would be fair to say that the CEO said they know how to do it. They're surprised it's not getting done here, and he wants to do it. We'll see what happens, but that's what he said to the community board. So, to their community board. So we'll see.
Okay. Thanks, Julian. So, next item's the expenditure list. If there are no comments, so move. Take a look at it.
I'm sharing it on the screen because it's sideways. Isn't that cool?
Yeah, kind of have to really turn your head in a really odd way.
That's the way my expenses are too. They're sideways.
I think we're supposed to try to make sure that whatever you're all voting on is visible to the public. And maybe the motion is visible, but anyway, but that's why I'm doing it. But it is also hard to read.
Yes.
I mean, visible as in it will be recorded?
Yeah.
Okay. Because obviously nobody could process this.
Because I'm spinning through it. Okay, I'll stop.
Oh, no, I don't want to slow you down. Go.
Thanks, Julian. Don't slow down, Lynn.
Joe?
Yes.
Do you mind if I poll my question that I asked you earlier regarding the quarterly reports?
Sure.
Okay. So next month in the CLC staff report, I am going to include second quarter reports. There are 29 agencies that do CLC reports. Are you interested in all of them? Or would you like to pick a few so that you can see what a few are reporting on? Joe's had his sentiments, but I said I wanted to poll the board as well.
What do you think? 29?
I don't know what you're asking exactly. Are you saying you want to give us a ton of paper?
Yes.
That's exactly what
That's
I'm
what
saying.
she's saying.
How long is each report typically?
What
How
did you
long
say?
is each report typically?
So with this report, I got a couple of them today, and they were running about maybe 2 to 4 pages each.
Chandra, you will review these reports before you actually send them out to the board, right? So if there's any irregularities, you will have already seen. You will have seen that, right? So I mean,
yes.
So you could weed them out. A sample seems to be fine as long as they're being seen by someone prior, and there's an opportunity to make sure that they are legitimate. Or sometimes you may even want to include one that's a little problematic, but 29 of them seems to be overkill.
Yeah.
Even though I'm going off the board, I think it's a little overkill.
And I assume if there's anyone on the board who says, wait, I do want all 29, those could be furnished to that board member.
Yes.
Yes.
And I'm not one right now, but I'm just throwing it out
just
there.
in case. So what I was thinking, I mean, just like
But I would like to share, the board members can look at the online system at any report they want to, anytime they want to. If you want to have access to the system, I can tell you how, or you can work with the person who developed the system and he can make it really easy. You can always look.
Well, may I suggest, if Chandra is presumably reviewing these in any case, that maybe it would be helpful if what you do is something similar to what the staff does when we're looking at the applications for funding. That is, there's a summary. So I think it would be fine if I don't even think you have to summarize them all at once. I think it might be instructive if there's X number and there's 4, and we're talking about quarterly reports, divide by 4, give us a sample, and maybe pick out the ones that are you think are particularly instructive, either because they're great or because they need work, or so we kind of have some sense of what's going on. But I'm not talking about all of them, and I'm not talking about even their full report. More your sense of here's what's going on with this one, and here's an example of this.
Okay.
Yeah. And even maybe what you recommended to them,
Mhm.
Okay.
Yeah, I mean, a sample of the 3 that you think are exceptional and the 3 that need work or something like that. Just,
or maybe you could select them over time to represent particular areas of attention that are either positive or negative, but things that, so we get a flavor of what you're dealing with. Does that make sense to you?
Yes.
Okay.
sounds good. So you got some good information there.
Yes, I do.
Okay, thank you. So, so we need to vote on the expenditure.
Right.
So, Stephanie?
I think I need a motion.
Oh, yes, we do.
Move.
Thanks,
I will
Tom.
second it.
Tom's ready to go.
Okay, let's see. Julian Rappaport,
Yes.
Jane Sprandel,
Yes.
John Paul Joachim,
Yes.
Tom Moore,
Yes.
Elaine Palencia,
yes.
Joe Amosage.
Yes.
And Joe, I wanted to add, going back to staff reports, I do have an update on my staff report, and
Okay.
that the Christian Health Center did turn in an audit on, I believe it was January 4th. So they are getting their payments again.
Thank you. Thank you. Thank you very much. Any board announcements?
Nope.
So we need a motion to adjourn then.
I move to adjourn.
I'll second.
Okay. So thank you for having a great, fast meeting. And, hey, Tom, this is the last one or next month?
Next one. February is my last one.
Okay, good. Okay, then we'll see
Okay.
you.
Good night, everyone.
Have a good night.
Good night.
Good night. Good night, Mental Health Board. It's time to go.
I used to sing that to my daughter when she was a baby, and I am not a good singer.
So guys, have a wonderful evening. Take care.
Thank you.
Bye.
Bye.